Hi pregnant moms, this is Dr. Linda Burke-Galloway, author of The Smart Mother's Guide to a Better Pregnancy, blogger and OBGYN physician. So today I want to talk about VBAC and whether a pregnant woman should have an ultrasound if she's contemplating having a VBAC. The topic came up with some of my readers because they want to have a vaginal birth after C-section. They talk about it with their midwife. And some of the midwives are recommending that they don't get an ultrasound, which I don't agree with. They're making that recommendation because they feel that if a patient has an ultrasound and the ultrasound demonstrates that the baby is, quote, big, then the patient is going to be forced to have a C-section, and that's really not true. So I want to talk about reasons why patients should have a third trimester ultrasound, and I have my cheat sheet here. I don't know if you're going to be able to read it or not, but I will certainly go over each item and talk about it. Okay, so let's talk very briefly about ultrasounds. Why do pregnant women get ultrasounds? They get ultrasounds because you want to make sure that the baby is okay. Now here's where it gets very controversial. Most ultrasounds are paid for by your insurance company. And even if you, and there are specific reasons why you have an ultrasound, you don't have an ultrasound. I know some of you are not going to be happy with this, but you do not have an ultrasound to see if you're having a boy or a girl. That is not a medical reason to have an ultrasound. But there are medical reasons that would definitely justify you having an ultrasound. So most insurance companies will pay for an ultrasound for a pregnant woman when she's anywhere between 18 to 20 weeks because you want to look at the anatomy of the baby, you want to make sure that the baby has all its toes, its fingers, and that there are no birth defects such as spina bifida, which you could see on the ultrasound. And then ultrasounds before 20 weeks or after 20 weeks, that's the gray area. I personally think that all pregnant women should get a first trimester ultrasound for dating because, and I think I talked about this before in a previous video, the earlier the ultrasound, the more accurate the dates are. The later the ultrasound, the less accurate the dates are. So dating is good in terms of if you want to find out exactly how many weeks you are, the earlier the ultrasound, the earlier that the ultrasound is done, the more accurate the dates are going to be. Okay, now let's switch over to the third trimester ultrasound. All right, so many providers don't get a third trimester ultrasound unless there's a compelling reason, and I am a strong advocate for third trimester ultrasounds, and here's why. Okay, so you want to make sure when you're in your third trimester that the baby is in the right position, meaning head down. Now, if you're 36 weeks and thereafter, your midwife or your physician should be doing a pelvic exam, and they should be able to feel the baby's head, which feels like a bowling ball, believe it or not. Or if there's the absence of feeling the baby's head, then the baby could be in the feet down position, which is known as breech, or the buttocks could be down, and that's also known as a breech. And if that's the case, then most people would not allow you to have a vaginal delivery. They would opt for you to have a C-section. So the position of the baby, item 1, is very, very important, especially in the late third trimester. Another reason for getting a third trimester ultrasound is to look at the fluid level. Item number 2, fluid level around the baby. There should be at least 2.5 inches or 5 centimeters of fluid or greater around the baby. If the fluid level is at 5 or less, the baby has to be delivered. And if it's at that, that funny in-between number of 6 or 7, anything less than 10 needs to be further evaluated. The baby needs to be watched. So fluid is very, very important in terms of the baby. The third compelling reason to get an ultrasound in the third trimester is you want to make sure that the placenta is where it should be. Now, Quite often in the first trimester and early second trimester, women have what's called a marginal placenta previa, meaning that the placenta is not quite covering the cervix, but it's close, or it's partially covering the cervix. And so you want to make sure that that placenta has moved away from the cervix so that the baby can be delivered easily without the placenta getting in the way. The other reason you want to have an ultrasound and look at the placenta in the third trimester is because the placentas are graded 1, 2, and 3. A grade 3 placenta is very old. And if the placenta is old, that's like the lifeline between the baby and its external environment, which would be you. So if the placenta is old and there's not a lot of fluid around the baby, those things give people a heads up, like, we really better watch this baby because it could have problems. And also, and the way that's shown on ultrasound is that there's what's called calcification, a lot of calcification in a third, in a stage 3 placenta. And usually if the placenta is old, the baby might have an increased risk of having something called meconium, which is where they have a bowel movement inside of you because they're stressed. So the placenta is very, very important in terms of giving us a lot of information in the third trimester. The fourth reason why it's important to get a third trimester ultrasound is what we call EFW, estimated fetal weight. And this is, where the controversy comes in regarding VBACs, because there is some opinions that if the baby is, quote, big, then the woman automatically would not be given a trial of labor. Now, that's inaccurate information, and everyone's definition of big is different. But here's the thing. Unless the baby weighs 4,500 grams, which is equivalent to 10 pounds, no one is authorized to drag you into the operating room to do a section. We have something called, what is the word? I'm trying to think of the term. Macrosomia. I'm sorry, I was having a senior moment. Macrosomia, fetal macrosomia, and the strict definition of fetal macrosomia is if the baby weighs 4,500 grams or greater. Now, it depends, if you're a short woman and you've got a 6-pound baby, if you're only 5 feet, that is a big baby for you. Whereas if you're a tall woman, 5'10" or greater, a 6 or 7 pound baby is not big. So it's all relative. So what am I saying? I'm saying that if you are contemplating having a VBAC, do not let someone talk you out of getting an ultrasound, because the ultrasounds are very, very important. Now, last but not least, there's a fifth reason why women should should get in, well, yes, should. There's a fifth reason that no one should deny you an ultrasound if you have this reason, but I don't want to talk about it on YouTube. But if you follow me on Facebook, Dr. Linda Burke-Galloway, or you follow me on Twitter at Your OBGYN at Twitter, YOUROBGYN, I will be more than happy to share that last reason with you. So until next time, I hope you guys have a great day. And remember, a healthy pregnancy doesn't just happen. It really takes a smart mother who knows what to do.